Welcome back to Health Matters. Joining me now are Mr. Bill Beam and Mr. Ray Terry. Bill is a colon cancer survivor and president of the Kentucky Colon Cancer Prevention Project. Bill has also been working with the Metro Department of Public Health and Wellness on a new colon cancer screening partnership. Ray Terry recently took advantage of the new colon cancer screening initiative to get screened for colon cancer. Bill Beam and Ray Terry, welcome to Health Matters. I'm really happy to have you both on the show with us. Bill, let's start with you. Tell us, how did you first find out that you had colon cancer? What was the experience like? And I'd really be interested in knowing how you reacted to that, what your initial reaction was.
Sure. I was working at the Salt Lake City Winter Olympics, and I'd been out there 2 years, and in 2001, I ended up in the emergency room. 12 hours later, the doctors came in and said, we have good news and we have bad news, and the good news is we know what it is, but the bad news is it's not good news. And they had located a tumor that turned out to be malignant in my colon. It was second stage colon cancer. So I immediately came home to Louisville and was in surgery within 2 or 3 days. Came out in fine shape. 5 weeks later, after recovery, I was back to work in Salt Lake City. You asked me my reactions were, and I've been asked this before, but somebody says, were you angry? And I said, yes, I was angry at myself. I was 54 years old, and I hadn't done what you're supposed to do at that age. They said, were you scared, afraid? And I said, yeah, I was plenty afraid that I was going to have to actually look at my daughter or my wife and say, you know, if I'd just been in here 3 or 4 years ago and done what the doctor tells you to do, instead of putting it off, we wouldn't be going through this, and I was afraid I was going to have the bad news. Fortunately, I announced cancer-free in 2006, and I'm healthier than I've ever been.
Well, congratulations on that.
Thank you.
I'm real happy for you.
Thank you.
You're the new president of the Kentucky Colon Cancer Prevention Project. Many people may not have heard about it. Can you tell us about what it is and what it's doing to raise awareness and get people connected to needed services?
Yes, sir. Colon Cancer Prevention Project is about a 3-year-old project started by a fellow who you just met, with Dr. Whitney Jones. As a colon cancer survivor, I came to the project after seeing their walk in the newspaper about a year ago. Didn't know about the project myself. It's a handful of doctors and surgeons and medical people and nurses and survivors and people that have been affected by colon cancer. And then recently, January 1st, I was made president of the organization. The things that we're doing right now that are of note are we'll be having our 3rd annual walk coming up in September. We just had a television program, Catching a Killer, which was very successful, and it was a call-in show and had a lot of people on that had been touched by colon cancer. And then probably the most important thing and exciting thing right now is we were the lead party with a whole coalition of cancer groups in a piece of legislation that just passed, House Bill 415, and it is the Colon Cancer Screening Act, which will make colon cancer screening available to uninsureds across Kentucky, patterned very much after the Breast Cancer Screening Act that's been around since 1990. Very excited about that.
That's clearly, I would think, a very, very important piece of legislation, because I would imagine that having no health insurance has kept many people out of the system to get screened.
It's probably the #1 reason, along with a little bit of ambiguity towards what colon cancer screening is all about. The #1 reason we find is the lack of insurance and the copay issues.
You tell us briefly what your role is with the Department of Public Health and Wellness and how that interconnects with this focus on colon cancer.
Yes, sir. I'm a project director. I'm a contracted project director. I was hired for the MSD, Metropolitan Steward District Rubbertown project, which ended up being the Community Health Screenings Project, which was, in essence, it was a consent decree for $1.2 million to screen 30,000 people in the western part of Louisville. And it started it's a 1-year project. We were able to get that program going up and running in September, and from September to October to November, we screened over 2,500 people in the west end of Louisville in clinics that moved around that part of town. Part of it was colon cancer awareness and assessment, and we were able to move 1,800 people through that to understand about colon cancer. We had over 900 people that were actually eligible, hadn't been screened, maybe uninsured, that elected to take a colonoscopy. We had 40 doctors in all 4 hospitals and pathologists willing to provide free colonoscopies to the uninsured people that we ran through. Right now, we're in the process of getting about 40 to 50 of those folks through, and it'll probably end up over 100 free colonoscopies for uninsured folks that went through that program. It's just an amazing community effort.
It sounds like a fantastic service to the Louisville community, particularly the West End and the Rubbertown area in particular, which was the target of this project.
Well, if you were going, and we will with House Bill 415, if you decided where to start,
yes,
it would be in an area just like the western part of Louisville right now.
Yeah, I know that the data nationally suggests that there is a difference in the frequency with which certain populations get this disease.
And that's the demographics in the West End. We'd find that.
Anything else that you need to share with us about your experience and your work with the Colon Cancer Prevention Project or with city government?
Well, I can say all of those. It's amazing how all those things have tied together for me personally in the last few years. If I'm a survivor, if I'm with the Colon Cancer Prevention Program, and if I ended up with the health department and this project coming along, it's been an incredible experience and journey for me in a very, very short period of time, and probably the happiest I've ever been. What I would say is that if I can put all of those things into one perspective, it would be please see your doctor,
yes,
do what your doctor tells you, learn about your health issues, particularly the things of colon cancer, about when to be screened, symptomatic health, family issues and such, and then please do it.
And what would you say to the typical person listening to the show if they're in the right age group, with or without a family history, they go to the doctor and the doctor does not ask them about these things?
Be aware, know it yourself, and ask your doctor.
Indeed.
Say, I really would like to know more about a colonoscopy, and I think I'd like to be scheduled for one, without a doubt.
Yeah,
without a doubt.
I appreciate that.